talking about.
All right. So the very next procedure we're going to go over is application of an incontinent brief. What do you do with the current brief that they're wearing? Place it in a trash bag and dispose of it in soiled utility. What do you want to do for the resident? Provide perineal care to make sure they're clean and dry. What do you do for yourself at this point? Change your gloves and wash your hands. And what do you do with the new or the current brief? You put the new brief completely back on. So for the test, you take the brief completely off, provide perineal care, change your gloves, wash your hands, and put the new brief completely back on. Next procedure, unoccupied bed. So is that a bed made with a resident in the bed or not in the bed? Not in the bed. Unoccupied, nobody in the bed. Where can you put your clean linens? Over bed table, bedside stand, or the back of the chair. How do you handle clean linens? Holding them away from your body. If they touch your body, they will be considered contaminated. What position do you want the bed in? Supine position. And where do you want the bed for your comfort? Up to your waist. How do we remove the dirty linens? Take the pillowcase off, loosen up the corners, and roll the dirty linens from the head to the foot. Don't let them touch your clothing. How do we place the clean linens on the bed? You fan fold, which is just a fancy word for unfold, don't flay. So you fan fold the fitted sheet, top sheet, and blanket on one side of the bed. What do you need to do to the bed before making the other side of the bed? Miter the corner. So you make the miter corner before you pull the linens to the other side of the bed. What position should the pillow be placed under their head? With the open edge away from the door. What does an open bed look like? It has the sheets folded down to the foot of the bed with the top edge closest to the center. What does a closed bed look like? It has the sheets and blankets up over the pillow with a tuck underneath. And what do you want to do to the foot of the bed for your residents' comfort? Loosen up the linen and make a toe pleat. Next procedure, occupied bed. Is that a bed made with a resident in the bed or out of the bed? In the bed is occupied. Where can you place your clean linens? Bedside stand, over bed table, or the back or the top of the chair. How do you handle your clean linens? Holding them away from your body. If they touch your body, if they're contaminated, you need to get new ones. Where can you put your clean linens? We just said that. Over bed table, back of the chair, top. What position do you want the bed in? Supine position. And where do you want it for your comfort? waist high. How do you place the bottom linens under the resident? Make sure it's tucked snugly against their back and there's no wrinkles or twists. What position do you put the pillow? Open edge away from the door. What do you do to the bed after this procedure? Put it back down in the lowest position, lower your side rails as appropriate. And what do you do with your old linens? The older dirty linens are secured in a bag and taken out of the room. Next procedure, thicken liquids. How do you thicken their liquids? According to manufacturer's instructions, so just follow the instructions that are given. And what do you want to do with the resident once you thicken the liquids? Offer them to the resident and encourage them to drink. Next procedure, passing fresh ice water. What are some things we do for infection control while passing fresh ice water? You need to make sure you keep the scoop covered. You need to make sure you do not let the scoop touch the pitcher or the cup of the resident, and make sure that the pitcher or the cup doesn't touch the sink when you're pouring it from the sink. So don't let anything touch, and make sure you keep everything covered. Next procedure, feeding a resident. What do you need to check before serving that tray? Check the diet card. Check for the name, diet, utensils restrictions, if any. What do you want to do for the resident before we feed? Wash their hands and face and offer a shirt protector. Where are you when you're feeding a resident? Sitting down, eye level on their strong, unaffected side. But you want to be sitting down. That's going to make sure that the spoon is placed at the appropriate angle. What position is your resident in when you're feeding them? At least 45 degrees. What utensil do we have to use? I mentioned it a minute ago, a spoon. That way we don't cause damage to their mouth. Who should you be talking to when you're feeding a resident? The resident. Talk with the resident. The environment should be pleasant and comfortable. What do you want to do with the resident after the meal? Assist them to wash their hands and face. Now this next procedure is assist to eat. So this is somebody that can feed themselves. What do you check before serving the tray? The diet card. Check the name, diet, utensils, condiments, restrictions, if any. Explain the procedure, assist to eat. Everything is just assist. Assist to wash their hands and face. Assist to protect their clothing if desired. Assist to open cartons, arrange their food per their preference, cut their food per their preference, and season their food per their preference. Assist them if they appear to be having difficulty with the meal. Assist them with washing their hands and face after the meal. Assist them back to their location or room of choice. Now the next procedure, inspecting skin. This is just flat out, gotta memorize it. So when you're inspecting skin, what are the bony areas that we're checking? There's 8 of them. We're checking the ears, shoulder blades, elbows, coccyx, hips, knees, ankles, and heels. What are we checking bony areas for? Redness and warmth. That's a stage 1 bed sore. Friction areas. What are the friction areas we're checking? There's 8 of those. Checking under the breasts, under the arms, any skin folds, thighs, groin, buttocks, tubing, and contracted areas. And what are we checking friction areas for? Remo, because you gotta ream out those areas. R for redness, I for irritation, M for moisture, and O for odor. If you find anything unusual, notify your nurse. Next procedure, floating heels. What and where are we checking? We're checking the heel, and we're checking for redness. Where do you place a pillow when you're floating their heels? Under their calves, leaving the heels floating in air. And what do you not want to use when you're floating their heels? Any rolled up pillows or blankets. Next procedure, bed cradle. What is a bed cradle used for? It's to keep the blankets off the top of their feet. How do you place a bed cradle on the bed? According to manufacturer's instructions. And where do you put the sheets and blankets? They go over the bed cradle, again, keeping them off the tops of their feet. Next procedure, passive range of motion. So who is doing the exercises, the resident or the CNA? The CNA for passive range of motion. What's the first thing you check before beginning range of motion?